Welcome to the Transforming Trauma podcast. Transforming Trauma is presented by the NARM Training Institute. The Institute offers NARM practitioner trainings for mental health professionals who are looking for advanced training in complex post-traumatic stress disorder. The neuroaffective relational model is a cutting-edge, innovative approach for resolving CPTSD, addressing attachment, developmental, relational, and intergenerational trauma. I'm your host, Sarah Buino, and I'm delighted to have you join us today. Please help me welcome today's guest, Deirdre Stewart. Deirdre is the Vice President of Trauma Resolution Services for Meadows Behavioral Healthcare. She's been with the Meadows for nearly 12 years now, and the Meadows provides a full continuum of care specializing in trauma and addiction. Deirdre is a licensed professional in the state of Arizona, board certified in Neurofeedback, trained in Somatic Attachment Focused EMDR, and Somatic Experiencing. So I hope you'll enjoy this conversation with Deirdre. Welcome, Deirdre, to Transforming Trauma. Hello.
Hello.
Hi, how are you?
I'm well, and you?
I'm good. It's been a heavy podcast day, which is always lovely because I get to have all these beautiful conversations. So I'm lit up right now.
Connecting all day.
Yeah. Well, I'm really excited to connect with you. And I've heard about the Meadows literally forever because I also work in addiction. And so I know of it, but I am ashamed to say I don't know that much about it and can't wait to hear more about you and the work you do. So, well, first, before we get into that, we'd like to ask on this podcast, what is it that you hope listeners will get out of our conversation today?
The first thing that comes to mind is hope. Hope that healing exists from trauma, from complex post-traumatic stress, that life beyond traumatic experience is possible, and that joy and freedom is a possibility.
Awesome. And that's what we want with NARM too, so it's perfect. Well, tell us more about who you are and the work that you're doing at the Meadows.
I started at the Meadows about 12 years ago, and I started in the workshop department doing direct patient care. It was an extraordinary experience. The Meadows is where I work on the main campus. It's a level 1 psychiatric facility, although we have a full continuum of care and serve a multitude of various populations. And the 12 years that I've been there, the acuity has definitely increased, congruent with society and culture. I mean, the amount of complexity that we're seeing is increasing, and patients coming in with higher levels of disorganization. And we use Pia Melody's model on codependency, developmental immaturity, that really is effective at treating developmental trauma. Since we've been introducing NARM, it's complements her model so beautifully, and it really is helping us effectively target the complex PTSD. So it's been incredible that way. So,
yeah, I definitely want to hear specifics about that, but let's talk about the population a little bit more first. And since you mentioned that the acuity has increased over the years, I'm curious, was there a time at which you started to notice that was shifting? I'm sure this is all in retrospect, right? Did you notice when that was shifting? And I have hypotheses of what may have been going on in the world that causes that, but I'd love to hear from you.
Yeah, I would love to hear your input on that, because I don't know that I have a lot of theory on why. When I first, self-disclose, I was an inpatient at the Meadows in 2003. I was already 4 years clean and sober, and my untreated codependency brought me to my knees, and I ended up at the Meadows, and it was a life-changing experience. And I knew when I left Wickenburg, Arizona, that one day I'd make my way back. I just could, it was like on a felt sense level, I could feel that. And even when I was an inpatient there, but also when I started working there in 2009, it was like, your average patient was, alcoholic, substance, with maybe some anxiety, some developmental trauma, maybe enmeshed with mom or abandoned by dad. And that was kind of it. And now, fast forward, and I'm just trying to think when I started noticing, I'm going to say in the last 6 years. Now it is the the developmental trauma, it's the PTSD that's gone left untreated, that's layered upon itself. And we get straight mental health more and more now, no addictions and, suicidality, self-harm, extreme affect dysregulation, no portable state shifts on board, ability to shift their state, no sense of self. And that's the other thing I think that's worth noting is not saying we've had to lower our expectation, but just our focus and our treatment is so personalized, but we've had to, which I love that about our facility, that it's not cookie cutter. It's very, very custom tailored to the individual, but we have had to do more work stabilizing and getting them actually into a working zone. Whereas before, some of them, and we still get patients that are already sober and they're just coming to work on their trauma, but then we've got some that are still in detox mode. So we have different tracks for the various needs.
Yeah. So thinking of the patient who is disconnected from self and presents with codependent type behaviors, what are you seeing in terms of the developmental trauma that manifests this way in a person? Because I am also personally relating to you, and this codependency brought me to my knees as well, and needing to go through a trauma program for the same thing. Exactly. So I'm right with you, and I'd love to crystallize this for the audience.
Okay, sure. So codependency, disconnection from self, or, PMLD describes it as arrested development, but we're seeing it's the relational trauma. A lot of it is the relational trauma. So the neglect, the profound neglect, sometimes it's profound, sometimes it's subtle, but that neglect, which is more the covert type of shaming where it's like nothing happened. So it's a little bit crazy making, it's like, how can I get upset about what didn't happen? A lot of enmeshment where we're not looking at the intention of the parent was obviously to do the best they could. And I hold a lot of compassion as a parent myself. But inadvertently using the child to meet their needs, emotional, physical, oftentimes sexual. And then, so neglect, enmeshment, and abandonment, physical or emotional. If there's an addiction, if one of the major caregivers has an addiction, then the child will be emotionally abandoned. But then also the whole realm of abuse, physical, emotional, intellectual, spiritual, all the abuse that we see too. And then also we see just the trauma that, motor vehicle accident, not even single incident, but that have been layered upon layered. So.
Right. Because if someone has developmental trauma, then a shock trauma that they experience later, they're going to be less resilient from.
Exactly. And we see that all the time, the layer upon layer. One other thing I was going to mention was there's so many elements of NARM that just blend so beautifully with the model that the Meadows has been based on for 40 years. But the disconnection from self, inability to love the self, boundaries is a huge, we see our patients unable to set a boundary, whether it's, you're in my personal space, can you please back up? I mean, not even knowing that they have the ability, not knowing that that's even an option to ask someone you're in my space, I need you to please back up. Like there's some agency. I know agency is not a behavior, but the owning our reality and taking care of our needs and our self-care and, being moderate and contained. So there's some guidelines that we use when we're treating the codependency. But again, NARM definitely fits so well with what we're already doing. That's why I'm overjoyed with finding NARM.
Yeah. How far in are you?
I'm starting second part of mod 3 this weekend.
Awesome. I was just curious because I'm kind of framing in my head all the information that you have. And so let's dig in a little bit more deeply into how you're integrating NARM with the work that you're already doing.
Well, I would say just integrating pillar 1 has been a game changer in terms of getting consent from the client / patient, because we also have an outpatient facility, but just inviting the patient to identify what it is that they most want out of their time at the Meadows. What's their heart's desire and what it is that they most want even out of the individual trauma session that they're maybe attending in that moment. And it's incredible how that has shifted everything. And again, it's also revealing, just to quote Brad, it's like they are not able to name what is most central to them a lot of the time. So that's been the work for the initial piece. And I know for me and some of our staff that are currently in the training, starting with pillar one and inviting that awareness in of what it is that they most want. It's like, it's hard to put into words how I could even get choked up thinking about it.
Yeah.
It's like what it is that we most want in this life. I mean, it's an incredible exploration.
Well, and I imagine you've had the same experience that I have with some clients who say, no one has ever asked me that before. And so I have no idea how to locate that within myself.
Yes, absolutely. And then, just how agency can be risky. I think a lot of our patients, they internalize that attachment failure of having to play small and dim their light. So really standing in their power, which sounds good, but there's a risk to it or there's a threat. I always think of that quote, and I don't know if it's Marianne Williamson or if it's Nelson Mandela, but, our greatest fear is not that we're less than. Our greatest fear is that we're powerful beyond all measure, and I feel like that comes up sometimes in these individual NARM sessions.
Well, right. And we talk about a NARM that it literally wasn't safe for those of us who experience that type of developmental trauma to step into our power if we were being objectified by our parents and our parents were acting out, like you said before, like enacting their own needs out on the child. For me to step in and be my powerful self, well, that would threaten the system and then I would be punished.
Yes, that's right. Talk about being in a bind.
Yeah.
Darned if you do, darned if you don't. It's like collapse.
Right. Well, I'm very interested in transformation that happens in different levels of care and watching people who go through a 30-day program versus I've had people go through a 3-month program versus seeing transformation happen in outpatient therapy. And so I guess I'm framing that before I ask more questions about how you see people transform in these different levels of care and how long it takes and what factors sort of play into that. So what's the typical length of stay at the Meadows?
45 days.
So that's not long.
And we used to be 35, and then based on all the research that said 45 is more impactful, and there was a bunch of research that came out. So 45 days is our length of stay for our inpatient programs. And in that time, I feel like sometimes the shift is subtle but powerful, and sometimes it's like, whoa. I mean, sometimes it's, just from people walking around with their head down to they're more upright, their spine's more erect, they can make and hold eye contact, they've more dropped down into the whole of their being, they're more, I want to say they're more embodied, they're more in touch with their life force.
Yeah.
And a lot of them are in early recovery, so still learning how to live more in that window of tolerance versus, 0 to 60, which even after 22 years of recovery, I know if my stress gets high enough, I can default there in a nanosecond.
Absolutely. Well, I guess let's also talk about, for folks who aren't familiar with the higher levels of care and how all that works, there are very few trauma-centered treatment programs, right? It's really mostly addiction treatment. And part of this, I think, is a diagnostic issue that for whatever reason, we haven't recognized that we need to have trauma diagnoses that actually represent what's going on for people. But I'm curious, if you could wave a magic wand and change the treatment system, what would you target? What would you change? What would it look like? And this is a really, really big question, but I think there are just so many opportunities that I'm hoping we can work towards. And you really being in the center of it, I think probably have some great ideas around what should trauma treatment look like and how do people get it?
Yeah, that is an amazing question. It's a big question. I'll unpack it or tackle it as best I can.
Whatever comes to you is what's supposed to come.
Without putting pressure on myself.
There
I've learned
you
that
go.
in NARM, that less efforting is gold. I think definitely, we do need that stabilization to happen. I mean, in the beginning, when they're still detoxing, we're doing gentle bottom up, doing the regulatory support, just stabilizing, first of all, just getting them in that working zone before we start to, but I think that's where NARM has been, again, not to sound dramatic, but it's been a game changer in that it's the top down and the bottom up simultaneously. And I don't know if it was Dr. Heller or if it was Brad, but one of them said, I think it was on one of the inner circles, they said, you can't regulate self-hatred away. And I mean, my mind just was blown in that moment, because it's like, the Meadows we have mastered self-regulation. And I just think it was a reminder that top-down simultaneously is just as important.
Mm-hmm.
But no, something else about the treatment of addiction too is that whole idea about the physiology, and with NARM, the psychobiological shifts that happen, and the change in physiology informs the meaning making, informs our thoughts. So it's like, and so I feel like by working top down and bottom up, we need both.
Yeah. Well, something I want to see is a more integrated understanding of what works. I feel like you said, that their research actually says 45-day treatment is what's best. So why are insurance companies still saying 28 days, right? And there's this really strict adherence to historical things that we thought were most appropriate, right? And the more addiction treatment centers I get familiar with, the more I hear very 12-step rooted work, which God bless 12-step. I'm a grateful Al-Anon, and it's worked so much in my life, and I've seen it work for other people, AA and all the other 12-step, but that doesn't get to the self-hatred all the time. That doesn't get to the self-regulation, right? And so what do you think we need to do as an industry to help bring more of this NARM-informed education to more treatment centers and to get insurance to pay attention?
I think honestly, what you're doing right now in this moment, just got to keep educating and getting the word out. Because I think those facilities and treatment centers that are on the cutting edge, they already know this to be true, and they've already integrated it.
Yep.
In terms of the industry standard, I think it's like one person at a time, one interaction at a time. I know someone who sits on a neurofeedback board, and they're fighting with insurance. They are pleading their case daily to try and get insurance to cover certain modalities that we need in terms of, because the research is showing reaching the limbic system is not enough anymore. So I think also just to not give up hope, because if you look back at where we were and where we are now, there has been some good traction and progress.
Yeah. Well, specifically from your experience, what have you seen change in the industry in the last 12 years in terms of our understanding of trauma and our implementation of that understanding?
I think we're treating the individual more versus we're treating the arousal. Like I know at our facility, we have the ability to take like a mini brain map, and we can see if someone's over aroused or under aroused or dysregulated, which is a little bit of both. Because you can have two people with PTSD, and one's over aroused and one's totally under aroused, shut down, collapsed, depressed. So we're not treating that diagnosis. We're treating the person. We're treating the arousal, their autonomic tone, their baseline. So I think the last 12 years I've seen is that we're treating the individual as a human being in the context of, we're not treating the diagnoses. We're more diagnostically agnostic.
That's a really beautiful answer to that question, and not necessarily what I expected, but I mean, that resonates so much with NARM and our desire to connect with our own individual life force and aliveness. That's so wonderful. Well, I'm curious if you have any stories in particular, whether it be a story of struggle or an inspiring story about how you working with clients and integrating NARM, right? How much time do you have? She says.
Maybe I'll share just that for me. I just want to back up and say it was funny. There were two people in my life, one of whom was on my team at the Meadows, was on the main campus trauma team.
When you were a patient?
No, I'm sorry.
Working. Okay.
Yeah, working. This was about maybe 2 years ago. And he started the NARM training, and I kind of knew that, but it was like in my periphery. And he reported to my subordinate, but he would drop by my office from time to time just to touch base. And it was subtle at first, and then it's like the quality of his presence was so different. I mean, it was excellent to begin with, but after he started in NARM, There was a shift that it was palpable. He was lighter, more spacious. There was something. And anyway, I know that it sounds kind of off the wall. And so that, and then also someone else in my life kind of NARM'd me indirectly so anyway, but this one person in particular, because I was experiencing the shift in him, I could see it. It's like when you see people in recovery, it's like all of a sudden they're like, they've arrived. They're like, and they're here. You can feel their life energy. Anyway, so I got curious and entered into the NARM training. And I always identify as a recovering training addict because I'm
not in recovery from training. I'll keep doing it.
I had sworn off trainings and then I relapsed with NARM. I'm like, I've got to do this training. It's been life-changing personally and professionally. And it's just odd to me how I was telling Brad, it's like there's an alien that's inhabited my body because it's like our first breakout group was the cohesion level was off the charts. We all bonded. It was the first modality where what was coming up for me as the therapist was exactly what the client was working on. That resonance, I'd never felt it so profoundly. And after that, I got us all on a group email. I'm an introvert. I'm just total introvert. My father calls me Irma the Isolator. I'm a loner, which is ironic in the field I'm in. But anyway, and then I got this group email. I was volunteering for demos, in front of 40 people. Anyway, it's like my heart is so open in this training, and it's the heartfulness. I love the heartfulness aspect of NARM because mindfulness is wonderful and it has its place and it's powerful and helpful and effective. I also just wanted to say, speaking of heartfulness, that a couple of inner circles ago, Brad was talking about heart openers, and like yoga have always been like tricky for me. So anyway, Brad started talking about how sometimes as a young, even as an infant, the child or the infant it basically can feel into the environment and it knows intuitively that its needs are never going to be met.
Yep.
And it shuts down. And it's like, when he said that, I'm getting goosebumps right now. I was like, the heart closing off. So it's like the heart's reopening, and it's incredible.
Well, and I also want to mention that your training's been online. So, because one of the things I'm talking about with my staff right now, some folks are struggling with the online format, and I have not had any issues at all moving online because NARM somehow, the embodiment, the heartfulness, just the way that NARM frames a connection with self and connection with the client it's just transformational, and it doesn't matter that you're on a computer screen at all.
You're 100% right, Sarah. It does. It transcends all of that. And that's totally been my experience. And I've done other online trainings that it's like, meh, it doesn't land like it does with NARM. So it speaks to the power of the modality. Yeah.
Right. It absolutely does.
I was thinking about at the Meadows, like, even one of my staff today emailed me and she's like, sorry, I'm feeling a little inadequate this week. And I have said, you know what? Inadequate's a lie. And because just as I think it's Dr. Heller that says, we're unlearning what we have taken to be ourselves. And I love that because I think of complex PTSD as layered. I think of a visual person and I think of the onion. And it's like, if I shed all these things that I'm not, then I get to drop down into all that I am. And that intentionality and the art of that, the consent and the first pillar is like, that is where the life force or life energy, I think, as Brad says, that's where we're following that. And that's where the gold is. And it's shifting the way I'm working with patients and clients, but it's also shifting how I'm supervising my staff.
Yes. Let's talk about that. Let's geek, because I'm super into that. Go.
Well, even when they're staffing a patient with me, and then I'll say to them, so what is it that this patient most wants? And they're like, well, I don't know. And so the countertransference. In neurofeedback, we have this expression, the clean windshield effect. And it's like, NARM has the exact same effect. It's like I'm seeing things for the first time. And it's like once I see them, I can't unsee them. And that's the good news and the bad news all at the same time. But I think it was the last mod, Brad said something. And I mean, it was like a whiplash, visceral, in a good way, though. It was like my whole body let go and released. The bracing let go was, you don't have the answer, your patient does, or you don't have the answer, your client does. It's like, oh, thank God. Like,
can we stop on that real quick?
Yes,
because that also was a transformation for me. And I think being from a household where I was gaslit, I had to develop the superpower of knowing what's true, whether other people do or not. Right. So I'm sure you can relate to this. I see you nodding. Right. So then as a therapist, I take this superpower into therapy, and I'm reading people's minds, and I'm quite good at it. Let's be honest. I am good at it. And yet that may not be where the client is. The client might not be ready to hear all of that. And I didn't realize how much I was pressuring myself to have the answer and to solve it for them and to do it the quickest way possible. I didn't realize until going through NARM, because I always had this fight with myself of truly like believing that the client has it all within themselves. This is the codependency. I'm just making this connection now, not trusting that they're going to get there. And that's my trauma. Right? Do you feel, yeah, you're just like nodding.
Totally.
Yeah. And so finally, now therapy is easier because I don't have to tell you what to do. I don't have to figure out what it is that's going on inside of you. You tell me.
Right. That's so incredible. And as you said that, two thoughts popped into my head. One is just sitting, listening to you. I was thinking, what do I want listeners to most get out of this? And it's like, you come from a traumatic childhood, and I do too. And I definitely have this experience that I'm connecting with another authentic human being. And like, if that's not the greatest statement of hope, and that I like right now I'm being my authentic self. I'm not, there's a freedom about that. The other thing was about the countertransference.
Yeah. The codependency of needing to have it for folks.
Just the way we can get so attached and involved to their process and the outcome. And it's like,
and it's subtle, right? It's so subtle. Cause I think about when I supervise really new clinicians, it's very overt. And there's like, we have an intern right now, and in our supervision group this week, she said she wanted to process grief. And so I got to do the grief and I got to have an outcome. So it's very overt when we start our careers. And then as we get more adept, we still have that need, but somehow it gets buried and it's less obvious. But NARM has really opened a way to, I was going to say move past, but it's not move past. It's like transcend and transform that. And now I can feel for myself, like I have a visceral feeling of when that codependent desire to like fix, manage, control, like all of those things within a session. Now I'm like, oh, okay. And I can just kind of like pet my little heart. Okay, honey, that's cute. And put that away. It's what the client needs right now.
I like that a lot. Yeah. And what you just said reminded me too, like listening to the patient, their narrative, and then watching the psychobiological shifts and reflecting those back and noticing them. And then that other piece that Brad talks about, is the third component is what is happening inside of me at any given moment. And some of the most powerful times I've had in NARM was when I was the therapist in the dyad or the triads or the group, and the stuff that comes up for me, like you were just saying, it's like, oh my gosh, is that emerging right now? It's like, yes, that is happening in the here and now, right now. Right.
Yeah. That's how I feel my supervision has shifted with my staff, is when they bring a case and they're all worked up about XYZ that's going on with this client, I'm always like, well, tell me about you. What's going on for you right now? And it's funny, a couple of the staff are now in NAR. They did the basics training and they're shifting right away to the therapist training. They're like, I need more immediately. And those folks who really are taking to NARM are so able to drop into that heart space. And I've found the survival styles. So for folks who haven't gone through the training, there are 5 different survival styles. And just based on the type of wounding and when it happened to you in your childhood, there are certain patterns that emerge. And watching my different folks who I'm seeing identify with different survival styles and the way that manifests in supervision is so cool. It's so cool. And watching the growth and the transformation from that.
Yes.
Such an honor. It's such a gift.
And I feel like the self-compassion that has come up, I've had increased self-compassion. And, again, some of our patients are the come here, go away. And, a lot of stars had to align for you to be sitting here in Wickenburg, Arizona. So I know there's agency, all that sort of stuff, all the strategies. Ultimately, they're just regulating their vulnerability, and we've all come by all of our strategies so honestly. And so the compassion, I think, is compassion for the practitioner and for all the patients that we serve and that we treat, that the human struggle, and to be free.
Well, and to bring this back to what needs to change in the treatment industry, I think that's a piece of it too, is compassion for the practitioner as well, right? It's less, let's conform the patient to the treatment that we do, right? The individualized treatment that you talked about. And the second piece is really attending to what's happening for the provider. You cannot go through NARM and not transform yourself. And I hope this isn't getting too preachy to folks, but I'm guessing if you're listening to this, you're also a fan as well. But it's just, you can't not transform.
Yes, I love that. I love that.
Well, is there anything else that we didn't talk about that you really want to make sure to share with listeners today?
2 quick things. One is, what was it? That thing in NARM where what I most fear has already happened. Like that was a huge aha, here I am, my whole life's been built around maintaining this attachment that I never had to begin with. I mean, there's something ironic about, so just the freedom that I had an aha moment with that. And then, just want to share too, that I'm noticing like in my own personal and professional journey, like with NARM, that there's still the self-sabotage that happens for me personally and professionally, but just the personal affects the professional, but noticing it and normalizing it and having compassion. But as I take 3-4 steps forward, there's a step back, because it's like I'm in new uncharted territory, which is the excitement and the fear and all of it.
Well, and that's, where disconnection and connection is so important, recognizing that as we take these steps forward, yes, there will be steps back. And that doesn't mean that you're not evolving and transforming and moving forward. That's literally part of the experience.
Right.
Yeah.
Right.
Well, I know we could literally keep doing this forever.
I know. And you're phenomenal. Your presence is so awesome.
Thank you.
One last thing, and that is, this is the first training where I haven't sat and just no notes. I'm just sort of osmosis. I'm listening, the idea of not pressuring myself as a clinician, and I'm in a parasympathetic receiving mode for my patients or my clients. And I have to just receive, stay open, and stay curious. This is what makes NARM different, I think, than any other modality I've encountered, is that we're exploring or inquiring not to get anywhere, just for curiosity's sake. And I think it was Brad who said, that's one of the missing ingredients of healthy attachment. And it's like, when we're in survival mode, there's no time to explore and be curious, so there's something so reparative and recorrective about that.
Wonderful.
I'm done.
Well, don't shut your lips just yet. Where can people connect with you, find more information about the Meadows?
Yes, you can find access to full continuum of care at themeadows.com. And we serve full continuum of care, inpatient treatment, IOP, trauma, addiction, best treatment center in the world, although I'm a little biased.
Right. Yeah, when you said you have the best staff in the world, I was like, no, I have the best staff in the world. Yes. So we'll fight about that later offline.
Well, that servant leadership. And I always have this, and I was bragging to this new recruiter, we have the highest rate of retention of any department. It's because if you take care of your people, they'll take care of the patients.
Right. That's exactly right. Well, Deirdre, thank you so much. This has been so lovely. I just love your energy, and your open heart is just beautiful. Thank you for sharing it with us.
Thank you. Thank you for inviting me to be here.
Thanks so much for joining us for today's episode. To find more about our guest, check the show notes or visit us at www.narmtraining.com/transformingtrauma. You can connect with us in many ways. On Instagram, find us under @the NARM Training Institute, on Twitter @NARM Training, and Facebook @NARM Training as well. The NARM Training Institute also offers the Inner Circle, an online self-paced learning program intended for anyone who is interested in joining an international online community focused on healing complex trauma. You can find more information about these trauma-informed learning programs in addition to other resources on the website, www.narmtraining.com. Thanks to Andrea Klunder and the Creative Imposter Studios for producing and editing, to Tori Essex for our album art, and to Brad Kammer for the creation of this podcast. We look forward to building community and connection with you and changing the world by transforming trauma.